let's look at a brain map that we recently have done on a patient. Let's go back to a recent brain mapping that we've done on an athlete. Here we go. So this is brain mapping on an athlete who's undergone some concussions. He's involved in football. And here we see very clearly areas of dysregulation. Now this is not an MRI image. This is an image that was produced following quantitative EEG and brain mapping using C-scores. And this was done without any radiation, any exposure to any kind of X-ray. And we're able to identify the actual electrical disturbances in the brain. So this is a person who sustained concussions. Concussions are impacts to the head that lead to damage usually to the frontal and temporal regions. Here we see abnormality in the right temporal region based on the patient's electrical activity. This is the temporal tip, and we see that also in the mesial temporal area. We see that on the axial, sagittal, and coronal images. And this patient actually has difficulty with concentration, memory, and emotional regulation, which corresponds to this area of injury. So if we scroll up, we can see some raw data. So here we see the actual electrical activity mapped out in terms of frequency and Z-scores. And this person actually has elevated Z-scores or standard deviations away from the ideal range in several frequencies. If we go up, we can see the actual topographic map. So here, each of the frequencies is actually shown very clearly. In the delta region, which is actually a slow wave, we see a lot of slow wave activity in the right temporal region, which is where we saw the Loretta abnormalities. This is an example of brain mapping revealing pathology in the brain without the use of X-ray or any kind of imaging, but actually using electrical activity of the brain. This patient is definitely a candidate for neurofeedback and transcranial magnetic stimulation, and within several sessions we can actually reverse a lot of these abnormalities and return this person back to his normal life.